Pancreatic cancer represents the four most common digestive cancer. The majority of cases are located in the head of the pancreas, representing around 70% of pancreatic cancer. Due to its location in silent development, symptoms usually appear at an advanced stage. The late discovery of pancreatic cancer often means that it's too late to consider an effective curative treatment, and the prognosis is therefore very grim. The treatment of pancreatic cancer is very complex and depends on the extent of the tumor and at the time of diagnosis. Pancreatic cancer accounts for about 10% of digestive cancers. The average age of the onset of this cancer is generally 55 years, which highlights the frequent occurrence at an older adult age. There is a male predominance with a 6 ratio of 2, meaning that men are twice as likely to develop this cancer as women. And the main histological type is ductal adenocarcinoma, which represents 90% of pancreatic cancer cases. This type of cancer forms from the cell of excretory ducts, contributing to its aggressive nature and its tendency to develop silently. In terms of prognosis, pancreatic cancer remains one of the most difficult to treat. The 5-year survival rate after pancreatic cancer diagnosis is generally less than 5%, reflecting the aggressive nature and the late discovery of this disease. However, if the tumor is detected at an early stage and a complete resection is possible, survival rate can increase, reaching around 20 to 30%. However, even in these cases, the prognosis remains relatively grim due to the possibility of a rapid recurrence. The risk factors of pancreatic cancer are divided into two main categories: exogenous, meaning external, and endogenous, meaning internal. Let's start with the exogenous risk factors, which are mainly related to lifestyle and external behavior. Smoking is one of the most important risk factors for pancreatic cancer. Obesity has also been associated with an increased risk of developing pancreatic cancer. The second type, which are the endogenous risk factors related to internal biological or medical conditions. People with diabetes are at an increased risk of developing pancreatic cancer. Chronic pancreatitis, wherever caused by alcohol or of hereditary origin, is a major risk factor. This chronic inflammation of the pancreas can lead to lesions that promote tumor development. Familial forms or genetic syndromes leading to increased risk, like Lynch syndrome, which is a hereditary genetic disorder that increases the risk of several cancers, including pancreatic cancer. Another syndrome, which is Peutz-Jeghers syndrome, another rare, well-documented genetic syndrome, also increases the risk of developing this cancer. Another endogenous risk factor, which is precancerous lesions. Certain benign lesions such as intraductal papillary mucinous tumors of the pancreas and mucinous cystadenomas can progress to cancer. And finally, certain specific forms of pancreatitis, often genetically transmitted or linked to tropical environments, are associated with a high risk of pancreatic cancer. We will talk about the clinical symptoms, positive diagnosis, and the treatment of this cancer in the following videos. Thank you so much for watching until the end, and if you have any questions, please leave them below. Goodbye.